T-minus 5 days before January 1st, when Americans still struggling to sign up for insurance on healthcare.gov will be left in the dark. Our next guest says he's one of those people, and he's been trying to sign up for a month now. Ike Brannon is the president of Capital Policy Analytics, and he joins us now to share his experience and his perspective of what took place. And I guess we should begin from the beginning, that this is something that you support, and yet it's become problematic for you. Tell us why, please.
Well, I wouldn't say I support it. I think there's a much better way to do health care than this, but I was all anxious to sign up. I started my business about 6 months ago, and my insurance was running out, so I have a family member with a pre-existing condition, so I thought this would be a good deal for me. And it still might be, but it's really tough to say, since it's really been difficult to get online and figure this thing out.
Well, once you did get online, Ike, what did you experience?
So when I signed up, it took me 2 or 3 times to kind of go through everything and enter my family information, and for that information to actually stay in there. I think I typed in our family's name, social security numbers, birth dates 3 or 4 times before it finally seemed to stay in there. And then after I finally managed to do that, it asked me for a number of pieces of information to prove that I was who I was. We actually did live in Washington, D.C. I really did have daughters, and that my wife really did have legal permission to stay in the country. So I downloaded this information, I uploaded this information onto on the internet, and that was about a week ago. I was finally able to do it, and it's still sitting in a queue somewhere, and it keeps telling me every day that my caseworker will verify that this information is indeed okay, and then when that happens, then I'll have permission to go through and pick out my health insurance.
So wait a minute, let me get this straight. You've done all the necessary things on healthcare.gov to enroll in the Affordable Care Act to get coverage, and you don't know at this point if your enrollment has actually activated coverage. So are you still waiting to hear from an insurer?
I do not have health insurance. It has not been activated yet. So what I did the other day is I called a health insurance broker who took me through the system, and basically what she said is that a lot of people she's dealing with a lot of people are getting hung up right where I'm getting hung up. And she called on behalf of me, and they said if he has uploaded everything into the system, if he selects, at some point I'll be able to select health insurance, and then even though I haven't met the deadline, I'll still be able to have insurance January 1st.
So Ike, what's the takeaway for this? What are you advising people to do now?
What's worked for me is I managed to call a health insurance broker, and that person had taken a lot of people through the system and kind of knew the ins and outs. So to me, it seems like that's the way to go.
So you were very proactive then, because some other people are saying, I just can't get on, I can't enroll, it's frustrating, forget about it. But you went ahead and took steps under your own advice, and now you actually have some coverage.
I still don't have coverage yet, but I'm told that at some point very soon I'll be able to actually access the programs and select a health insurance policy.
Well, look, we thank you for sharing that with us, because a lot of people are still out there trying to meander through it. And Ike, we wish you all the best as you move forward with your health coverage. Ike Brannon, he's the president of Capital Policy Analytics, and we thank you again. And by the way, have a happy New Year as well.
Thanks, appreciate it.
Well, then what are we going to do? And I said, you take their driver's license. You make sure they know that if they're not listening to their parents, you take the license.
Representative Shore, thank you so much for your time today.